this story about how this Dr. Alan Money came up with this plan for Cigna and United Healthcare and other giant health insurance companies back a decade ago to have doctors that they hire and pay very, very well to basically refuse payment, review the medical records and refuse payment of literally tens of thousands of people a day. Just, you know, click and deny, click and deny, click and deny. This is what these guys do all day long, apparently. And you know, and they name a bunch of doctors in here: Dr. Cheryl Dopke, D-O-P-K-E, and Dr. Money, and there's a couple of others who are in here. There's just Dr. Richard Capek, C-A-P-E-K, Dr. Paul Rossi, R-O-S-S-I. These are doctors who take a lot of money to deny your claims. Well, this is making these insurance companies insanely profitable, as you can imagine. And now Elizabeth Warren and Jeff Merkley are calling attention to this, the two senators, saying that these massive profits and exorbitant executive salaries at top Medicare Advantage providers, such as United Healthcare and Humana, are wrong. This is a quote from a letter that they wrote to these companies, the two Democratic senators. In 2022, the 7 major Medicare Advantage healthcare insurers, United Healthcare, CVS Aetna, Cigna, Elevance Health, Humana, Centene, and Molina, brought in revenues of $1.25 trillion and reported total profits of $69.3 billion, a 287% increase in profits since 2012. But rather than investing in patients, these 7 health insurers instead spent $26.2 billion on stock buybacks. Brian Thompson, who became United Healthcare's CEO in 2021, brought home nearly $10 million in total compensation. Wouldn't it be nice to get a paycheck every month for $1 million? Well, I guess he's getting $900,000 a month, you know, his paycheck. Humana Chief Executive Bruce Broussard raked in more than $17 million. He's getting more than $1 million every month. Can you imagine in the first very month you look at your checking account, oh, they just put another $1 million in there. How nice. What could anybody possibly do that's worth that? Who works hard enough that they should be paid $1 million a month? Critics of Medicare Advantage argue that such overpayments, this is by the federal government to Medicare Advantage, were being ripped off by Medicare Advantage to the tune of billions. Those overpayments topped $15 billion in 2021, the last year we have statistics for, quote, are depleting the Medicare trust fund at the expense of patients who are frequently denied medically necessary care. This article about this by Jake Johnson over at commondreams.org, he notes, even though the Biden administration's proposed reforms would still leave Medicare Advantage plans with payments that are around 1% higher per enrollee in 2024 compared with this year, in other words, they're getting even more money, the insurance company has characterized the changes as a cut. And the New York Times reported earlier this week, quote, Medicare officials have been inundated with more than 15,000 comment letters, roughly 2/3 including identical phrases from form letters. Insurers use television commercials and other strategies to urge Medicare Advantage customers to contact their lawmakers. This is from the New York Times. That effort generated about 142,000 calls or letters to protest the changes. These are changes that would allow the federal government to stop Medicare Advantage providers from ripping us and our government off, right? According to the Better Medicare Alliance, one of the lobbying groups involved. Amazing.